Joining me now is Dr. Jonathan Reiner of George Washington University Hospital. He is the cardiologist to former Vice President Dick Cheney. Doctor, I'm so glad you're here. Thank you so much. These are important times. A lot of people are watching. They want good information, and you're here to supply it. So thank you for joining us. I really appreciate it. You doing
My
okay?
pleasure.
Yeah.
Yeah, I'm fine. Thank you.
You say that this is a watered-down recommendation, and it comes down to the fact that the administration knows that there aren't enough masks.
Yeah, this is really a half-baked, completely inadequate half measure that comes weeks too late. Look, I think the bottom line is the reason why we haven't had a firm recommendation from the CDC for people in public to wear masks is very simply and very sadly that we don't have the masks. Don, if you look at how testing was rolled out in the United States, the first patient tested positive for the coronavirus on January 20th, and it took 51 days, that's a week short of 2 months, for us to test 20,000 people in this country. And the reason why we weren't more widely testing and the reason why we had such stringent restrictions on who was tested then was that we didn't have the tests. So now, many weeks into this crisis, into the singular public health crisis of our lifetimes, of the century, people in public aren't wearing masks simply because we don't have them. We've known for a long time that masks prevent transmission. If you look at photographs from the Spanish flu pandemic 102 years ago, everyone in the street is wearing a mask. We wear masks in the operating room to prevent transmitting infection to a vulnerable patient. Why would we not be wearing them on a packed subway train?
So, Dr. Reiner, I just want to, you're pretty clear to me, but I want to make sure the audience, because sometimes they're doing other things and they're not paying attention as closely as I am. They have lives. I'm not saying that I don't, but just sitting here talking to you. You're saying everyone should be wearing masks when they're out in public. It should be mandated that we wear masks.
So I work at George Washington Hospital, right 6 blocks from the White House. And a couple of weeks ago, the leadership in my place decided that all staff, physicians, nurses, and staff in the hospital would wear masks. Not to protect ourselves from the patients, but to protect ourselves from each other, right? We've known that about a huge proportion of people with the virus, anywhere between 20 to 50% of people with the virus have either minimal or no symptoms at all. And that's where a lot of the transmission comes from. So you wear a mask in public to protect, your neighbor, the old man down the street, the person who's just had a kidney transplant. That's how you slow the spread of this virus, by wearing a mask in public. What did they do in China? What did they do in South Korea? Not only did they have draconian social distancing and quarantine practices, anyone in public was wearing a mask.